Hello, dear viewers. Welcome to another episode of Afya Health and Lifestyle Interview Series. In this episode, like every other episode, we intend to shed more light on the health issue that we face all around us and how best to deal with them, prevent them, and treat them, and to put an end to all the unnecessary myths that are not true concerning such illnesses. Today we'll be treating squint in children, and our guest is going to be Dr. Halimi. Before I bring her up, I would like you to get to know her better.
Halima to Leila Alimi, name Azai, hails from Kogi State of Nigeria. After completing her primary and secondary education at Command School, Kaduna, between 1975 and 1986, she proceeded to Ahmadu Bello University, where she obtained her MBBS in 1992. Dr. Alimi had her residency training at the Lagos University Teaching Hospital, following which she successfully passed the final examination of both the West African and Nigerian postgraduate medical colleges, and she obtained FWACS in 2003, FMCO PHTH in 2005, respectively. She had a subspecialty training in pediatrics ophthalmology and squints in 2019 at Isafani Islamia Eye Institute and Hospital, Bangladesh. She established and has been the medical director of the Anur Eye Center, Surulere, since 2003, a center that specializes in adult cataract surgery, glaucoma management, management of pediatric surgical conditions such as cataracts and squints, and many other medical ophthalmology pathology. She is married to Dr. Mustafa Alimi, the MD of National Orthopedic Hospital, Igbobi, and the marriage is blessed with 3 children.
Thank you very much for joining us, Dr. Halima Alimi. Welcome you to Afya Health and Lifestyle Interview Series. And just like the intro and the intro to the interview said, we'll be treating squints in children. Squints in children. So, without wasting time, for our viewers' sake, what exactly is squints?
Thank you for asking me to speak on this topic. A squint is a misalignment of the what we call the visual axis of the eye. And so to break that down, normally when a person is looking straight ahead, both eyes should be looking straight forward in the forward, position. However, sometimes you find out that either one or both eyes isn't looking straight ahead, in when you're looking, straight in front of you. So you might have a situation where one eye is looking straight and the other is deviated, or one eye is blue, or both eyes. Sometimes it can actually involve both eyes. And a squint, so that's what we call a squint, is essentially a misalignment. So the eyes are not both aligned in the straight ahead position. And it can occur in any direction. Sometimes the squints can be inward or outward or up or downward. And so, it can really be in any direction. So essentially that's what a squint is.
All right. Thank you very much, ma. That is a actually very common thing we see all around us with people with eyes going in a different direction. But thank you for shedding a light into. Now we know what it is. In what age group is it possible? What age group are we going to find squint the most? Is it common to everybody across all age group, or there's a specific set of people that are predisposed to squints?
No, not necessarily. Squints can occur in just about anybody. Sometimes in brand newborn babies. Actually, if you take a good look at babies when they're awake, when they're newborns, they're asleep a lot of the time, most of the time. But when they're awake, you find actually quite a lot of newborns have squints. That's just because of the immaturity of the visual system at that point in their lives. And then this will quickly align itself for most babies within a couple of months. But you might find in a brand newborn baby, or you might have squints developing sometime in infancy, whereas there was nothing as a newborn, or you might find it developing even in early childhood, as a toddler, or indeed squints can come up in adulthood where a person never had a squint as a child. And so there's no particular age that cannot have squints. It can start at any time, including a brand newborn baby.
Okay, ma. Okay, ma. Thank you very much, ma. So you are saying that even in adults, 40 years upward, 50 years up, it can develop at that point in time.
Absolutely. Any age. There are certain diseases
And,
that can give rise to certain events that can give you a squint. Yes, even in adulthood, yes.
all right. Talking about certain diseases that can cause that in adulthood. In children, what are the things that can cause it?
Right. So in children, basically anything that stops an eye from seeing properly. And so this can be
Okay.
any lesion at all, right from the front of the eye all the way to the back. So if a child has a scar on what we call the cornea, the part where everyone sees as black, looking just casually at an eye,
Yeah.
if you have a scar there
Okay.
obscuring view, the eye can squint because it doesn't have good vision. If you have what we call ptosis, ptosis means that the lid is drooping. So sometimes you look at the person and you see that the lid is drooping and covering the center part of the eye. So that eye doesn't have good vision.
Okay.
So such eyes, oftentimes
Yes.
we find them squinting. If you have a
Squinting.
cataract, so cataract can be found in children. Sometimes you can have what we call congenital cataract, which are born with a cataract. So if you have children with cataracts, it also obscures their view. If you have children with glaucoma, this also obscures their view. If you have a child with any other lesion inside the eye, at the back of the eye, and I'd like to give a special mention to a cancer of the eye called retinoblastoma. And so this is the commonest cancer to be found in childhood. It's also the commonest cancer to be found in the eye in children. And so if you have a retinoblastoma, that can also present as a squint, even because before it's obvious that there's a tumor inside the eye, basically because it obscures vision. And so once an
Okay.
eye doesn't have good vision, it loses alignment. Now, other diseases of the eye, of the nerve, of the retina, so there's quite a lot of diseases in the eye, anything that obscures vision. Now, apart from obscuring vision, if you have a basic immaturity, an imbalance of the eye muscles, and so we have our eyeball, and our eyeballs can move in several directions. We can look up, we can look down, we can look left or right. All of these are controlled by muscles. So there are muscles that contract to move your eye upward and downward and any other direction. And if you have a disbalance in the power of these muscles, let's say for instance, the muscle that should move your eye to the left, it's more powerful than the one that should move your eyes to the right. There's a disbalance. So there's a net pull in the direction of the stronger muscle. And so sometimes this sort of imbalance happens in early childhood or in infancy just because of immature nature. Or maybe developmentally, the muscles didn't quite develop the bulk or the position where they should have been. Something about that muscle has made it either too weak or too strong and therefore pulling in the direction that it shouldn't. Also, if you have a brain disease, so sometimes the eye muscles are not in balance and the eye can see well, but there's a problem from the brain. Remember that the nerves that control the muscles of the eye are supplied from the brain. Their origin is from the brain. So if you have, say, a
Yes.
child who has had either what you call cerebral malaria or meningitis or an abscess in the brain, anything that gives rise to pressure within the brain can put pressure on the nerves of the eye and cause a disbalance in the muscle, action. Many other things, injury. So if you have an injury, a brain injury, this can affect nerves as well. And so basically, we can classify squints into three basic groups of causes: anything that obscures vision, any imbalance of the muscles of the eye, and anything that affects coordination in the brain. So any of these
Okay.
can cause squints. So these are basically in
All right.
children the commonest causes of squints.
All right. Thank you very much. That is quite extensive. So, Max, looking at the courses you've given us, the courses for Squint, can we really say that Squint is basically the body trying to correct the anomaly in vision? So, for instance, there's something wrong with the eye, you're not seeing properly, or the alignment is wrong, and you develop Squint in such a way that it can correct the vision. Is that what you're saying, man?
No, 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 not necessarily. What I'm saying is
Okay.
for the eyes to be aligned and work together, you've got to have
Okay.
good balance in the eye muscles, you've got to have good
All right.
vision, and you've got to have good coordination between the two eyes in the brain. So anything that leads to a breakdown any of these factors would make the eye squint. So when you see a squint, the message is something is wrong. So we have to investigate. The squint doesn't happen to correct vision at all. The squint happens to show you that the eye has decompensated for some reason. So we want to investigate and know, is it just weak muscles? Is there something in the eye? Is it a visual problem? Or is it a problem from the brain? And so a
Great.
squint calls attention that something is wrong. It's not compensating at all. It's not. It's the result of poor vision, and it can also lead to poor vision as well.
All right. Thank you very much for shedding light on that. So, I would like to ask, Ma, what are the effects of squinting in humans? So, what effect is it going to have on a person? I know, of course, there will definitely be psychological effects because of course, our society and everything. But from your professional point of view, what are the effects you can see that squinting would have on a person?
Yes, so I've just said that when your eyes, in order to have good balanced vision, what we call binocularity is required, which means you need to have both eyes looking ahead at the same object. The brain processes the image and gives you a three-dimensional view of what you're looking at. And so if something interferes with this, such as an eye squinting, once an eye is squinting, it means the two eyes are no longer working in tandem with
Okay.
each other. And therefore you don't have binocularity. It means that you cannot see in 3D. You can't see, something in 3 dimensions, something to give you depth. So there are this first of all affects the functioning, visual function of a child, even in class. And so you don't have a
Okay.
view of the board. Some of these children have what you call diplopia, which means they're seeing double because one eye is looking at
Okay.
an object and the other eye is looking at another object, and these images
Yeah.
are superimposed. And so sometimes they have what we call confusion, two images, on each other. They have diplopia, which means you can have images that are split, and then you just don't have, if you have a child who doesn't have binocularity, they look through a microscope in the science lab, they're not looking with both eyes. And so this affects what they're looking at. And so it can be a reason for poor vision and therefore poor performance. And when, as adults, there are certain jobs you cannot do if you have no binocularity, if you don't have 3D vision. For instance, you can't be a surgeon. If you have to be a surgeon, you have to operate, you must have 3D vision. It also affects being in the military. It affects if you want to be a pilot. And so there are certain jobs you just can't fit in properly without that 3D vision. And so it's very important. So visually, this is important. But a huge part of the effect is also the psychological effect. Maybe before I before I go to psychology, I should just tell you about the vision bit to say that if you don't rectify that by a certain age, the eye becomes disadvantaged permanently, such that even if
Oh,
you can align that eye later, it doesn't catch up visually any longer. And so
okay.
the need to be able to, depending on the type of squint, there's a type of causes of squints that you have to intervene very early. Otherwise, you
Then,
don't really, especially the ones that obscure vision. If you don't intervene early, then the visual deficiency is permanent. That's on the one hand. Now, on the psychological
permanent.
aspect, this is a huge lot of things. Indeed, the way the patients, the human beings perceive things, the psychological aspects are even more, important for them because there's a lot of name calling, people making fun. It affects their self-esteem. And so such children are usually quite subdued. People always, it's a ready tool to latch on to hurl insults. And so it can become a real psychological dampener for a child, And so this is very important, especially the girls. And this is the age where people are very self-conscious. And so it's going to affect them, even for things like relationships, marriage, getting spouses. These things are important, especially in girls. And so we need to, nobody is exempt anyway. Everyone needs to have nice, balanced, aligned eyes. But I'm just
Yes.
talking about effect, saying that when it comes to the psychological effect, it's usually much more for the females. And so these are the various effects, of squints.
All right.
Yes.
All right. Thank you very much, man. Thank you, Dr. Alima Alimi. You said that if it is not properly taken care of as early as possible, it can become permanent. That explains why we are more focused on children right now. And Most of
That's
our
right.
viewers are going to be mothers and fathers and adults that want to learn how to take care of people in this condition. So, what advice can you give them? What should mothers, fathers, parents do when they have children with this condition?
Right. So, should you find that your child's eyes are misaligned, you need to, at the earliest time, as soon as you notice, have it checked out at the pediatric ophthalmologists. So, you need to see an ophthalmologist. An ophthalmologist is a comprehensive eye care specialist, a medical doctor who has gone ahead and specialized extra studies on the eye. And if you want to analyze a squint, really that's in the purview of the pediatric ophthalmologist, which means this ophthalmologist has gone back again and re-specialized in just children's problems,
Children.
including squint. And so, because that person would be able to reassure you if there's no trouble. So, remember, we said immaturity itself can be the cause. And so,
Of
it means
course.
that your pediatric ophthalmologist can have a look and tell you, let it be an ophthalmologist reassuring you that there's no problem.
Problem.
And like I said, as early as you've seen it, because remember, there can be many other things going on in this eye. The fact that the child is a newborn baby doesn't mean the child cannot have a cataract in that eye, or a child born with glaucoma, or any other nerve problem or problem in the eye. So you need to have it checked out and followed up. So it's not enough to be reassured. Your ophthalmologist would always give you follow-up appointments. You need to honor these appointments.
Yeah.
You, like I said, the
Appointments.
vast majority will just sort of, the ones due to immaturity would write itself. But you must have it checked out at whatever age you notice that your child's eyes are not aligned. Certainly, if you notice any other thing along with it, any funny glow from the eye, any whitish shadow in the eye, get it checked out. That's very important. And so there's this common misconception that I hear it a lot from patients who would tell me, parents, that they've noticed the squint when the child was an infant. But neighbors, friends, and all of that tell them, oh, don't worry, it will go away, or leave it until the child is like 7 years old, and then analyze. This is really wrong. This is the wrong information. You need to have it checked out immediately. And depending on what the doctor says, you will need to have follow-up appointments to make sure that things are right. And should on examination the doctor discover anything significant that needs therapy, you need to act quickly as soon as you're advised. Some therapies can be delayed, some can be immediate. So the doctor, knowing what's causing it, will know what the need is, how emergent treatment is. And so you're advised to follow the doctor's advice.
All right. Thank you, ma'am. Talking about doctors now, how is squint treated? How is it treated?
Right. So there are various modalities which squints we need depending on what the cause is. And so there are many squints that will respond to spectacle use. Sometimes squints are associated with having very high refractive errors, which means focus problems. And so some of these squints actually are amenable to the alignment gets better with a certain types when the child wears glasses.
Yeah.
Sometimes squints need to have squint surgery. And so sometimes it's a surgery that the child needs to have. Like I said, there's the muscles are not well aligned, and therefore you need to either work on the muscle surgically to either increase its power or reduce its power to balance up the other muscles so that the eyes are straight, no muscle pulling unduly in any direction. So sometimes it can be glasses, sometimes it can be surgery, sometimes it can be a
Surgery.
combination. A good number of children who eventually have surgery may start with spectacle use. That's because we may find that the child also has more than one thing going on. So the child has focus problems, long-sighted, short-sighted, or what have you, and you're using glasses. And then you might find that the screen somewhat gets better, but not totally. So depending on what is left of it, that child may still need to tidy up what's left
Surgery.
with the surgery. Sometimes straight away we see that there's no significant refractive error, and then the child can be immediately advised to have surgery in that instance. But oftentimes there's a workup. Sometimes the eye that has been squinting, if it's only one eye squinting, is become very weak visually. We call that lazy eye or amblyopia. When that happens, in order to increase the chances of the surgery, which the child might eventually have, work better, we need to strengthen that eye. And so sometimes we do what we call patching therapy, where we patch
Okay.
the better eye to favor the weaker eye for some hours in the day. This might happen for some months before the child eventually has surgery. Because if you do not improve the vision, the drop off in vision was the reason the eye was squinting in the first instance. So if you don't build up the vision and you just do the squint surgery, it's going to squint again. And so sometimes you need to have certain initial therapies before the child eventually has surgery, but not all children end up having surgery. Some of them are amenable to spectacle use.
All right. Wow, wow, wow. That is a whole lot. Um, of course, prevention is always better. Um, Before we go into prevention, maybe there are any ways we can prevent screens from happening. I want us to talk about the peculiarities of the Nigerian system because most of our viewers are Nigerians. And we know that the average Nigerians pay for health from pockets. So, is there any process that we need to follow in order to sort for treatment for squints? Is there any way that can make it easier? Is there a government procured process that would make getting treatment for squints very easy?
Well, we still have a situation in the country where most people still pay out of pocket for medical, for health, treatments. We have people who are on the HMO system who might be able to access care, but sometimes I tell you, when it comes to highly specialized care like squint surgery, that may not even be in the package.
Cover.
Even when you have an insurance, yes, cover. And so it's not an easy situation, to be honest, if you consider that a lot of people are still living well below the poverty line. And these surgeries are usually done most of the time, especially for young children. They're done under general anesthesia, which means you need a second specialist involved. So apart from the pediatric ophthalmologist, you need an anesthesiologist. And so the demand, the cost, there's a high overhead cost of doing these surgeries. And so of course, the cheapest system is still the general hospital systems, but in the general hospital systems, you're not likely to have a pediatric ophthalmologist. And so you might have to go up to a tertiary system where, like a teaching hospital, where you might find one. Of course, the cost goes higher. Now, our levels of affordability will differ. So whilst there are people who can afford what it'll cost them, there are others who may have to look for cheaper ways. And right now, the only other way I can think of is to have maybe philanthropic people helping. Some people have foundations, a few, they're not many, but a few foundations that can cater for child eye health. So I know one or two, but this is probably not the forum to mention their names, but there are children's foundations that you can, approach, and they'll be able to give an assessment and decide how can this child be helped. And so at reduced fees, the child may be able to get levels of sponsorship that will help them, or perhaps even free treatment. But that is when the patient does find such a foundation. And so it's not easy, but there are very few choices where to go, really, both for finding the specialist and finding the finance. But if people go online and Google up, child eye foundations, they might find some that they can go to help them, with this sort of. So that's really the only way. It's not cheap. It's quite pricey, to, get a screen surgery done, all considered. And if you can't be out of pocket, you might have to be looking for some foundation that can aid you.
Ma, talking about prevention, of course, we know that prevention is always better than cure, and it will even save the stress of needing a lot of funds for corrective surgery and all of that. So, what advice do you have for parents and guardians concerning prevention? If there are any tips that can help prevent this?
Right. So, if we're talking about prevention of squints, there are certain causes of squints that you can prevent by avoiding the situation that led to it, but not in every case. So, for instance, the preventable one, squints from injury. So I mentioned head injury. So any situation that can potentially predispose a child to head injury can end up leading in a squint for that child. So, for instance, if a child has, measures you can take to prevent injuries in children, for instance, would be things like seat belts, while in cars in case of accidents, headgear, protective headgears for contact sports and things like that, having protective gates at your stairway in the house when you have very young children so they don't fall all the way down the stairway, and there's any other thing, contact sports and what have you. So anything that prevents head injury will potentially can prevent a squint from that cause. We also mentioned immaturity, that the system in the eye muscles can be immature, and this can cause squints. Now, when you have a fully mature baby, there isn't anything you can do about if it's going to be immature. Immaturity is worse in a premature child. So some children are born premature for one reason or the other. And therefore, if you want to reduce the number of children that end up with squints as newborns, we can reduce premature births, then this will help also. For instance, good antenatal care, very good antenatal care, good delivery services, good neonatal care services. These will help to reduce, squints as well. If you have cataracts in a child, when the child is born and the child is quickly diagnosed with cataracts, if the cataract extraction is done at the right time, the eye doesn't squint as a result of the cataract because it was tackled before the visual system became so bad, the eye is now misaligned, And so anything that's preventable would fall within those categories. Also, if you have a child who has a febrile illness, the child is ill, has a fever, attend to that quickly. And that is where we want to discourage self-medication. Because if a child has a meningitis, for instance, and you go treating the child for malaria, and then the child now has time to get really severely ill and fall unconscious with high pressure in the brain, that's likely to affect the nerve supply to the eye, and amongst many other things, and end up with a squint. And so these are in terms of prevention, these are the sort of causes that you can hope to prevent. There are causes that are not preventable. Some children are born with hereditary or some genetic diseases, or just peculiar familial diseases that affect especially the nerve of the eye and the optic nerve, as well as the retina. There's nothing you can do about it. Some of the children are actually born almost blind, near blind. And so when you have such situations, those are really not preventable. Those are genetic diseases, and so the preventable ones will be the ones from infection, from injury, as well as prematurity, reducing premature babies. So basically that's the bits what I can say about prevention.
Thank you very much, Dr. Alimi. Lastly, before we go, you mentioned earlier about a certain misinformation that used to go around concerning squint about waiting till, let's say, 7 years old before you look into, which is very, very bad, especially knowing that there's a time frame for this thing to become, for squint to become permanent. So what other in that line, what other misconception or myth is out there concerning squints that you'd like to let our viewers know so they can tell their neighbors, tell their friends, and proper information can go around from here?
Okay. But just to be clear, a squint can be turned permanent when you find that going back at any age, even as an adult, you can go back and actually do a squint surgery. The problem is the eye may not remain aligned for too long if the vision is already permanently poor. And that's the part where we talk about permanency. If you say the child has a visual problem and you don't write it, and the eye now squints, because of that visual problem, because it's taken so long, even if you go back and do the surgery, the eye may not remain straight for too long. It turns out again or in again. And so it's not actually the squint. So if you talk about a squint being permanent, in real terms, you can always go and do that surgery and then the squint is gone. The question is, will it endure? Will it stay straight? That would be the question. Yes. So, so like I said, some of the misconceptions out there, people talking about waiting, for 7 years or whatever age before you have it checked out, or people saying, oh, it runs in my family. We all have it. That doesn't mean it's not treatable. And so that's not the reason why it should not be checked out. In any case, the cause of squint in one person may be different from the cause of squint in another person. Okay. And then the notion that there's a diet you can eat that will get rid of this squint. People just carrots, So yes, we know carrots are good and bringing full of vitamin A, just like many other orange and red colored fruits and vegetables we know. But carrots will never substitute. It's not going to make the eye straight. And then the notion also that glasses, oftentimes when I see patients, I have a hard time convincing them, even when I show them examples before and after pictures of people who have done squints. They believe the child should just keep on using the glasses and that the glasses will ultimately correct it. So this is yet another misconception that people have. Some people believe that it's a spiritual problem. They don't believe in the first instance that, they think it's more to it that meets the eye. And so, again, we want to say to them there are definite causes. We can tell you what the cause is, what's going on with your child, and it is amenable to treatment most of the time. And so, I also want to debunk that myth. I think that's basically, those are basically the commonest myths that I've heard about squints. Okay, perhaps also a lot of people believe in alternative therapies. So apart from the dietary thing, a lot of people believe there are herbs out there that they can use, and that helps to straighten the eye. Again, doesn't happen. So this, I think, are the basic misconceptions that I can debunk today regarding squints.
Thank you very much. This session has been very, very educative, and I am very sure that our viewers and our subscribers would have learned a whole lot from this. So I want to thank you once again, Dr. Alimi, for this wonderful session with us. Do not forget, our dear subscribers, to subscribe and follow us on all our social media handles as we bring more and more educative interviews to your doorstep. Thank you very much, Dr. Halima.
Thank you for having me.
All right.
Right. Okay.
So, dear viewers, thank you for joining us today once again. We look forward to your questions and your suggestions under our video on YouTube. Please do inform your friends, family members to subscribe so that we can learn one or two things every week in, week out concerning our health, because the goal is to ensure that we have better and healthier life. Thank you for joining us. Thank you.